Platelet-rich plasma. Platelet-rich plasma, or PRP, is a biotechnological product that is synthesized from the patient's own blood and used for a variety of clinical applications in orthopedics and sports medicine as well as in internal medicine. Let us have a look at the basic science of PRP. In whole blood, there are a variety of cells such as red blood cells, white blood cells, and tiny little fragments which are called platelets. Platelets are very rare as they take up only 0.4% of all blood cells. So what do platelets do? Firstly, they are involved in the hemostatic sealant. In other words, they stop bleeding. Then, platelets produce the scaffold for tissue regeneration and are involved in the healing of wounds. For this to happen, platelets produce a variety of cell hormones such as growth factors. Platelets also attract stem cells. How do these growth factors work? On the left side, you see a growth factor molecule. Essentially what happens is that on the cell membrane there is a little receptor protruding from the membrane. When the growth factor binds to the receptor, it causes some intracellular changes, often all the way down to the DNA level, producing different proteins, changing the function of that cell. As previously mentioned, in whole blood platelets are very rare. In PRP, however, the platelets are highly concentrated. Why is this important? The answer is that there is a direct proportion of the amount of platelets and the concentration of growth factors. The more growth factors, the stronger the effect for tissue regeneration. So how is PRP produced? A small amount of peripheral blood is drawn from a patient's vein. The blood is placed into a centrifuge for several minutes. Then, the red blood cells are discarded and the remaining fluid is placed into the centrifuge for a second time. Now, the platelets can be isolated and activated, for example, with ultrasound. On the left side, we see the platelets in a resting state. They look spherical. On the right side, we see the activated platelets. They show little cell feet called pseudopodia. In this activated state, they release such proteins like growth factors. Now these activated platelets are injected into the site of tissue degeneration. Accuracy of the injection of 2 to 5 millimeters is vital to the success of treatment. Why is this so? As we see in this short movie, these activated platelets attach themselves to the injured tissue and start to release the growth factors and other cytokines. Now, which growth factors are important in PRP? Firstly, there are the platelet-derived growth factors, 130 times more concentrated than in whole blood. PDGF is a very basic growth factor involved in many cell functions. Then there is transforming growth factor beta, 80 times more concentrated than in whole blood. And finally, there is vascular endothelial growth factor, 11 times more concentrated. So what do these growth factors do? Here, both pictures show cells of a tendon, fibroblasts, which have been growing for 14 days. On the right side, you see a much higher density of cells. Why is this so? These cells are grown in a medium that has been enriched by PRP, with the growth factors PRP and TGF-beta. Both growth factors speed up cell division, including collagen 1 and 3, which is vital for the strength of a tendon or a ligament. What else can we observe with PRP? On the left side, we see a status of a normal tendon repair, and on the right, the repair process has been fostered by PRP. All these little dots are tiny blood vessels, a lot more than on the left picture. This is the effect of VEGF, and this effect is very important as the tendons can only grow when there is enough blood supply. Limited blood supply or little to no blood vessels in tendons is considered to be one of the most critical factors in the healing of a chronic tendon or in ligament damages. What else? The PDGF of platelets attract stem cells, more precisely, mesenchymal stem cells. These mesenchymal stem cells are fascinating. Bone, tendon, ligament cartilage, all these cells go back to mesenchymal stem cells. Attracting these cells is like playing a joker in a cards game, and that is what platelets can achieve. Now let's have a look at where to use PRP. PRP is very promising, and very good clinical results have been observed for a variety of problems such as tennis elbow, golfer's elbow, achillotendinitis, plantar fasciitis, tendinitis of the shoulder, fasciitis or tendinitis in low back pain, radiculitis, tension-type headache, and also other uses for cartilage, spine disc regeneration, wound healing, and dry eyes. One thing is important. In most cases, one injection is sufficient, as the platelets attach themselves to the damaged tissue and can continue to produce these important growth factors over a longer period of time. One last point. Are there any unwanted effects of PRP? Yes, there can be. Too little concentration of platelets, no sterile conditions, and unprecise injections are the most problematic ones. However, it is important to mention that PRP is derived from the patient's own blood. It is a so-called autologous biological device, and thus there are no immunological problems to be considered. So what can we conclude about PRP? PRP is an autologous blood product with a high concentration of platelets. The platelets produce a cocktail of cytokines and growth factors, which trigger and accelerate the regeneration of chronic tissue problems, such as inflammation and degeneration. If you'd like further and more in-depth information on PRP, there is quite some literature around. For example, Mishra and Pavelko published a paper showing a 93% improvement in tennis elbow pain after 1 year. If you would like any further information, please visit our website, where you'll be able to find more detail about clinical applications, patient testimonials, references to scientific literature, and other audiovisual content. Thank you for watching.